Hi, my name is Sonali Ranjit. I am a radiology resident at the University of Virginia. I am a second-year resident and part of the Spencer B. Gay Global Health Program at UVA.
I'm Spencer Barrett. I'm a second-year resident, and I'm a member of the Spencer B. Gay Global Health Program.
I've always been interested in global health. I've been a part of global health projects since I was an undergrad, specifically traveling to Africa, and it's a big part of what I'm interested in. I have family that's still in Africa, and my mom's side of the family was born and brought up there, so I think it's important for me to go back and kind of get in touch with my roots. As for global health, radiology is such an expansive field, but I think we can make a really big difference just based on the modalities we can use to help the clinical team and help the patients and make a big impact on the little resources that they have.
Global health has been something I've had a passion for a long time. I was exposed to it at a young age when I helped my parents kind of start a clinic in Malawi. So I've got a connection specifically to Africa as well. I think it's very important when you get involved in global health that you have strong mentorship. The Spencer B. Gay program definitely provides that. I've continued to have an interest in global health specifically because I think that it kind of goes back to a big reason why a lot of us go into medicine, and that's to have impact on improving the lives of others.
The program was a little different than I had initially expected because they do have a radiologist there who's really built up the program pretty well. Instead of us doing more on-the-fly, like case-based clinical scenarios, we transitioned into a role where we are actually teaching the residents and teaching them radiology, which was something I wasn't quite expecting, but it ended up being a good thing because us teaching them actually helped us.
So an additional priority for the Spencer B. Gay Global Health Program is to build relationships with these residents in Uganda and the radiologist in Uganda. Part of doing that is not only taking a trip overseas, but continuing that relationship in the interim between trips. The way that we are actually doing that is via Skype lectures. So we have material that they'll request that we give a lecture on. We prepare a lecture, and then over Skype, we will run through a lecture and kind of answer questions.
I learned how to become more patient. I think that's an important skill to have. Where our medical setting here, it's a very fast-paced environment where stuff is always on the go, and we can, get whatever tests we need, whatever lab tests we need, CT scan, X-ray, anything we need at the drop of a hat. In Africa, specifically in Uganda where we were, they didn't have that luxury. They really took the time to decide what they wanted to order, what they wanted to get for the patient, because with their limited resources, they could only order certain things that could have a big impact on patient care. And I think especially in radiology, that's important to know and understand because we're just so used to ordering stuff pretty blanketly and having it available really quickly.
I think a big thing that I brought back from Uganda was kind of a change in my own mentality, and that is being more flexible. In the United States, especially within medicine, we're kind of given very rigid structure. We kind of glorify efficiency, and if you take that mentality to another part of the world, you're going to have a lot of difficulty. So being able to be flexible, whether that means changing the schedule about what lecture you're going to give when, or deciding to give the lecture at a different time, or if you're going to use a different modality than you had originally anticipated. Just being able to find unique solutions to problems given certain resource limitations.